This particular module I've entitled Keywords. What's a keyword? It's a single word or sometimes a phrase that completely changes the question. And by learning to recognize keywords, you can learn to get the core of the question and not miss it. Oftentimes, if you miss that key word, you can get the entire question wrong. So sometimes the key to getting the answer right is just knowing your key words. So let's look at an example of a question. I'll put it up on the screen. A known alcoholic presents to the ED with complaints of severe epigastric pain that radiates through to the back. The patient lies in a fetal position and rocks back and forth. Abdominal distension and bruising to the center of the abdomen are noted. Which of the following interventions carries the highest priority in this scenario? Did you see a key word in that question? A word that would actually change the answer? If you said the word highest, you got it correct. Absolutely, highest priority. Now, why is that a key word? Because if you read the choices, you may find that all 4 choices may actually be correct. They would be something you would do for this patient. And so if you just think, if you miss the word highest priority and you say, what are we gonna do for this patient? And the first one you read looks right and you pick it, you could get it wrong. Because even though you would do it for the patient, it may not be the highest priority. So the word highest completely changes the question, right? Let's look at the 4 choices here. Preparation for intubation, initiation of an IV line, administration of oral cimetidine or Tagamet, or administration of oral contrast for abdominal computerized tomography. So if you look at it, I suppose potentially at least 2 of those could be correct. I would say that an IV line would be correct because the patient has bruising in the center of the abdomen, which tells you what? They're bleeding. They have a hemorrhagic pancreatitis, but also this patient's probably going to need a CT of the abdomen, right? I'm not sure that Tagamet would be appropriate here. I don't see a reason for it unless there's something that I'm missing in the question. And this patient, there's nothing here that indicates intubation. But B and D could be correct, but what's the highest priority? And of course, if the patient's actively bleeding, which we assume they are because they have bruising in the abdomen, your highest priority would not be the CT of the abdomen, it would be initiation of an IV line. So that keyword highest helps point you to the right answer. If you're a person who tends to read questions quickly, my recommendation is if you find a keyword, take the time to write them on the piece of scratch paper that you'll be given when you go in to take the exam. By writing the keyword down, it helps commit it to memory, and as you work on the question, the fact that it's in your memory will help you keep it in your focus. I hope you found this helpful, and watch the rest of our series for lots of other tips on taking your certification exam. Good luck in your studying.